conversation by asking each one of you on your take on the importance of One Health. And I think that will set the right context for this conversation. So I'll start with Dr. Gulati.
Thank you, Rashmi ji, for giving me the opportunity to talk about One Health. One Health, what I understand, is collaboration, cooperation and coordination between veterinary professionals, medical professionals and people working in wildlife, people working in environment for the betterment of diseases. Because diseases, whether they are animal diseases or human diseases, they are crossing over. We are getting diseases from animals, which we call them as zoonotic diseases. And it is the other way also. We saw during COVID-19, as she was talking, COVID-19 from human being was going into animals also. We saw lions affected, we found cats and dogs affected by COVID-19. So diseases are moving from one area, from animals to human, or from environment or wildlife to animals and human. So they are moving across these sectors. But what the healthcare professionals in human, they are working in vertical, they are working for the health of human alone. The veterinary professionals, they are working, taking care of the veterinary and livestock animals alone. And the wildlife people, they are working for the wild animals alone. Whereas diseases are going across these barriers. So there is need that all these professionals work together, they collaborate, coordinate, cooperate, so that we are focusing on the disease, not focusing on those who are affected by the disease, because we are going to tackle the disease. So it is must that we cooperate, collaborate, and share the information, communicate with each other, work together, so that, for example, if some disease is coming from wildlife, so wildlife people must also be doing the diagnosis and giving the inputs that we are finding disease in wild animals. The livestock people, they get ready and start working on preventing the spread of disease to the domestic animals. And from domestic animals, they are collaborating and cooperating with healthcare professionals and giving them the alert that they also take care and get their preparedness ready, diagnostic or treatment or control measures, preventive measures, so that we can work on the disease. So this is why the One Health concept has been initiated, and Government of India already taking many projects and many programs on One Health. Dr. Sindhura will be talking about that. This is what I want to just introduce. Thank you.
Yeah, thank you very much, Rashmi ji. Well, before I actually give my opinion of One Health in my own way, but I would like to be the previous, actually I have some specific comment on the previous, actually the topic, the dairy industry competitiveness. Though we our lot of actually the industry friends are not here, but one thing I would like to share it here, whatever we have actually industry people. If you want to be a competitive, you have to be innovative. That's one of the important and two words actually. No word in any word actually or anywhere, no one can be a competitive if it is not innovative. So this is one important, that point was actually the reason. Well, let me thanks actually the Telangana government. This is a really excellent initiative. I am very happy, and this is actually, I think is also very important to Telangana government to have actually the very motivated, very, very intelligent actually the minister, honorable minister, and they have made this initiative. I'm very happy to knowledge partner also, and especially our Dr. Kulkarni has given opportunity to be here to be shared us. But the academia industry has actually big gap. Actually, we can see from the thing actually the majority in this room what was actually into the actually when the industry people are discussing. So this is them. Anyway, the word one thing, just like our colleague Dr. Gulati has very specified it. But the word health, if you look actually the data, And as far as the definition of what health concern, I'm not going, they are very elaborately discussing. But if you look at the data as far as the animal health, because whatever the nothing it is, we can say the balance and optimize as well as between human health, animal health and environment. If you look the balance between all, that's basically the purpose of the One Health is concerned. But if you look, the data is really alarming, and that's very, very important. 60% of the diseases, of any sort of diseases, is come from the domestic animal as wild animal. If you go more actually critically, 70% emerging diseases today is coming from the animals. And another way actually, which is the threat for the nation, not for the India or our countries, but also the worldwide, 80% actually the diseases or the infections are the actually animal origin, which is concern for the bioterrorism. So this One Health point of view is not only for this in terms of health, but also the social actually as far as our countries are different across the boundaries concerned. So that's actually the data is really very, very alarming in terms of One Health is concerned. So this is a very, very important. So that's why I really appreciate this white revolution linked with the global, which is actually going to be a need for next. If you look actually as far as the revolution, our white revolution is concerned, everyone is talking. In 1950, we have a milk production 17 million ton, now we have 200 million ton. Probably more than actually the 1,000% increase as far as time actually increase, 1,000% increase in milk production. But the concern here, because the white revolution is not only affect the productivity, the production of the milk, also the quality as far as human health is concerned in the white revolution is concerned. But the major risk also is important, and the major risk is as far as environmental issue is concerned. The environmental issue is two major environmental issues is the feed and fodder and water. This is going to be a big major. In morning also the Niti Aayog member Rameshji also was telling, Dr. Rameshji, that this water and the feed fodder is going to be a big problem on the risk. Apart from there is the diseases is also, if you look at, there is one data by the FAO that 70% actually the protein we required actually by 2053 is by the animal feed. Animal actually the protein is going to be as far as the measure is important. But at the same time, that's the production of the production of the milk production or any production of the animal productivity, whether the meat or milk, it is going to affected by 20% by only by the diseases, by the global diseases concern. So these are some of the major concern, and that's why this One Health and the white revolution is going to be a major challenge in coming year, particularly next to decade as far as this is concerned. So this is just my one point, and then I will discuss some of the important aspects. Thank you very much.
Dr. Sindhura.
Thank you, Rashmi. And I thank the organizers for the opportunity. It has been quite amazing to see. I have come to Telangana before also and met with some of the officials and been impressed with the drive and the desire to keep pushing the boundaries in terms of how to progress. In terms of the One Health, when I was trained as a veterinarian, then I became basic science researcher, and then I worked in human health, maternal child health for most of my career. And now I'm back working on animal husbandry sector and also working with the wildlife sector. So in some ways I've been kind of living this, going back and forth across the sector, I guess like the diseases that Dr. Gulati was talking about. I won't try to repeat what they have already said elegantly on why One Health is needed, but I'll try to add a couple more points. One is that if you take just India, the human population has been talked about a lot now in the last few days, and it's true of animal population as well, domestic animal population. Pretty much in every aspect of it, India is on either number 1 or number 2 in the top. And we also have one of the highest biodiversity hotspots in the world. So it creates this recipe of intermixture, which is on the one hand is our strength, and another hand it's a risk that we need to manage. And with the other risk is that increasing mobility The same person could be here today. I came from Bangalore yesterday. I was in the US previous week. And that global mobility, if you look at the pattern, it is tremendous in the way it is growing, which creates the risk in that diseases anywhere become diseases everywhere. So that's another reason why we need to think about this one. I have many other things, but I'm addressing your question. But I also am struck by, I interact with many of the dairy industry partners, and this is quite telling. They are very comfortable. All our industry partners, private sector, cooperative, they are very comfortable in talking about numbers in terms of supply chain, production, market segmentation, positioning. But they are very uncomfortable, or there is a major gap in their understanding of diseases. That is telling in the way how they don't find this that important. And that is a bit of a problem and an unfortunate thing if you don't really address it. Because if you saw during COVID what happened, how rapidly it affected every sector, especially these sectors. And some of that was indirect, right? COVID affected everything. Some of that was very direct. People thought it's coming from poultry and it plunged. And then people said protein will help, it came up. So in the way we communicate, in the way we understand is very important. If you don't understand this sector, you will always become somewhat fearful of it, but never be able to manage it properly. That's one thing. And the second thing is related to that is you would want to have, if you are a large entity like Amul or NDRI or any of these, you would want to have enough, or the other aspiring growing industries, you would want to have internal knowledge on how to plan for it. There is a role government has, which I will come to it, but for these private sectors, it is important that you have that enough internal knowledge and enough interaction with the sector to know how to manage this, say, lumpy skin disease. It directly impacted it. African swine fever hugely impacted the sector. And now there is an emerging strain of foot and mouth disease. I have been getting the report, which we don't have in India, but it is spreading near Iran, etc. We need to be thinking about it, planning for it. So I will end this saying, that is why we need this approach. And I'll end saying, I'm always amazed at how Mr. Korean was able to see to the future. He wasn't an expert in any of this, right? So we are in Hyderabad. I often go see Dr. Srinivasan, who basically established the R&D facility in Indian Neurologicals, working under Mr. Korean directly. And to be able to see at that time that if we were to grow this industry, we need to manage diseases better. To do that, we need to have ability to make vaccines, make products, and that's how the Indian Neurologicals was born. So fast forward, if we are not able to think that far, we don't even need to think that far. If we don't think about that current and the immediate future, we will be regretting that.
Thank you, sir. Thank you, Rashmi. In fact, I may be the odd man in this discussion, which is too technical. Probably you must have included me because I'm a veterinarian. Basically I'm an industry man. Yeah, of course. I have to tell this today, World's Veterinary Day. So we should wish all of them, veterinarians, veterinarians, best of luck and then best wishes to them.
Very apt to have this discussion.
Yes. And One Health, it's a very good topic for the current scenario. And I want to add one more thing. I think we have to add the plant health also in this integration. Because after all, the food is nothing but plants. So, since the animals are shared by human beings and then we are living with them, so a lot of integration among everything. And so this is one thing that I want to add, the plant health, because the food and the way ingredients carry lots of biologicals into the food and then aftermaths, after effects, and all that is also a big concern in the current scenario. So in that perspective, One Health is very critical and significant, for every food industry. Yeah.
Thank you very much for sharing your perspectives. What I'm actually hearing is that there are a few risks that we need to be aware of, and as Dr. Sindhura mentioned, biodiversity is one, mobility of people, animals is another, and also one of the most important things is the lack of understanding of each other's sector. We often tend to only look at our own sector and our own area, but how it interacts with multiple other areas, that is somewhere we need to work on. So I think the bottom line of what all they all said is we have to have a collaborative approach. We really need to break silos, start working together, and there have to be innovative approaches and there have to be innovations that need to be brought here. And I think one of the most important things again here is the industry-academia collaboration, because that will improve our understanding and that will also improve our innovations bringing to the commercialization or market. So with this, I think I'll come to you, Dr. Gulati, now, that given the importance of surveillance in all of this, right, to predict and prepare for any future potential risks, there are certain mechanisms in our country that are existing. So if you could just tell us about what are those mechanisms and how these mechanisms help to allow for a timely and effective response.
Thank you, Rashmi. Surveillance of diseases is one of the most important activity for preventing diseases, whether they are affecting animals or human, or whether they are zoonotic diseases. So for surveillance, currently human health, veterinary health, surveillance is separate. It is not working as one health concept. What in veterinary sector we are doing is, we have a system of collaboration with every state government. Every state has state animal husbandry or veterinary services departments. They have the veterinarians with them, they have paravets with them. They are working in the field, they are working at district level, taluka level or village level. They are looking at the cases of disease occurring there on real time, and they collect the data and they send to the Central Department of Animal Husbandry as well as to our institute, which we call as National Institute of Veterinary Epidemiology and Disease Informatics. So this is one mechanism. We have collaborators. They are getting the real disease data. The other way of doing the surveillance is that we are instituting some epidemiological investigation at different places, which we call as some sort of sentinel surveillances. We make sites which are prone to infections. If you talk of, as Dr. Sindhura was saying, African swine fever, that came somewhere from China border into India, in Arunachal Pradesh and Assam. And then if you talk of lumpy skin disease, that again came from China border or Bangladesh border into India. It entered somewhere in 2019 in Orissa, Berhampur district of Orissa. So if we are like, it is like we have border security force which is looking for enemies. Similar kind of surveillance system should be or is there for livestock diseases or human diseases, so that before they cross the border and enter into our country, we know that this threat is going to come. So that we call as risk assessment before the disease occurs. When we are getting the data, disease is spreading in our neighboring countries, that we are doing the SAARC countries or Asian countries, we are monitoring the data of disease occurrence, and based on that we do the risk assessment. How much is the risk involved of that disease occurring in India? For example, when we talked about lumpy skin disease, in 2019 we made an alert to the government of India that this disease of lumpy skin disease is likely to come into India, be prepared, be prepared. So, but that alert was not given so much of consideration at the policymakers level, or the decision support system did not act on those inputs, and what is the consequences? We lost more than 2 lakh cattle during last 2-3 years, and we lost, we were calculating that per cattle milk production alone, because of lumpy skin disease, in Indian cattle, desi cattle, there was loss of 5,800 rupees. Whereas in exotic or crossbred cattle, 7,400 rupees worth milk production was lost. And if we look at the losses caused because of this failure on our part, we estimated the losses in Rajasthan state alone. It was more than 2,500 crore rupees for the livestock or cattle industry. So it is a big impact. If we look at the entire country, how much it must have affected. So this is where the surveillance is more important. What we are doing is we are getting data from all over the country, and then we make the risk alerts 2 months in advance. For example, for the month of June, we have already communicated the risk of certain livestock diseases to all the stakeholders, whether it is central animal husbandry department or the state animal husbandry department or district authorities, so that they take preventive measures. They have 2 months of window. That is good enough if they need to do vaccination, or if they need to have biosecurity measures. So this kind of surveillance system is in place. This is what I think we want to mention. Thank you.
Thank you, Dr. Gulati. I really like the analogy of the border security force, and I just hope that going forward, the warnings sent by surveillance systems and the institutions are heeded and not ignored. So my next question is very specific to the White Revolution track of the event that we are in, and I wanted to ask that, given the complex nature of interactions between human health and animal health and plant health, how do we ensure that the culled cattle or the culled animals do not become epicenters of diseases and future outbreaks? So I would like to start with Dr. Sindhura on this question and then come to Dr. Singh.
I think the specific answer to that question, if I understand the question, how the culled cattle becomes, meaning slaughterhouses and source of, okay.
Correct. How do we prevent that they do not become the epicenter, because they are then isolated, and then it's very likely that they spread the diseases more.
Yeah. Let me try to answer it in a couple of ways. One way to prevent that is by preventing the disease overall. If you haven't done a good job of preventing the disease and controlling the disease in the population, just going into a slaughterhouse and hoping that you can prevent TB or other diseases would be not possible. So the best way to do that is controlling the disease at the population level itself. And there are many ways to do that. One is having a strong surveillance system that Dr. Gulati was saying, and we are now looking at introducing technology such as environmental surveillance, which has a lot of powerful ability to pick it up with very low level concentration of the pathogen in the environment, like sewage system. If you take sewage, we knew that during COVID we could actually tell how much case is happening in the city. In polio it has been used for a while. Now we are looking at how that could be implemented for animal diseases. So then you know, even long before it shows up in an animal being sick or dead, you know this is likely to spread. So that is one. More sensitive surveillance. And second is control measures. Oftentimes for many of these diseases, control measures involve vaccination and ensuring the vaccination coverage, and sometimes movement control. It depends on the disease. So having that population level control is the best way we can do justice to all of this. It's the most cost effective way. Yet, it doesn't completely make us ignore what we can do in, say, at the point of processing or slaughterhouses or downward. There also similar systems need to be in place. The same environmental surveillance can be applied to this effluent that comes out of the slaughterhouse. If there is a disease spreading, because it's a beautiful catchment area, animals from all over the place come to that one place, and you can actually you will have the power to detect what is happening. And within slaughterhouse itself, there are guidelines on how you need to slaughter, how you need to examine. And sometimes it is enforced, sometimes it is not. It's a matter of how you better enforce. It's not as easy as said, because slaughterhouses are operated at, some are national level, some are state level, or some are at the municipality, and it's but that is something we need to do as a society and as an industry if we were to give the confidence to the public that this is safe for consumption, and we want to also prevent that becoming the epicenter of next disease outbreak.
Right, and my follow-up question to that, to the points that you made was, who is really responsible for ensuring that all of this happens?
Okay.
I think your question was targeted to not the culled animal.
Goshalas
When the animals become unproductive, we are leaving them, we are disowning them. They are on the stray, they are coming stray animals, or they are ending up in the goshalas.
Yes.
Yeah.
Okay, that was your question.
That's the question.
On both, because I asked, I clarified, yeah. In Goshalas, yeah. Orphan animals are also the same thing. Right? So, in the sense, we cannot ignore, once you put an animal in a Goshala, you cannot just close your eyes and ignore. The same system of assessing disease risks and disease spread risk needs to be implemented there. And same set of control measures also need to be implemented there. And we almost have to rethink how we think of Goshala, not just as something that we can put aside and close our eyes, right? So that they are not on the street. Because now that is a model that as a country we have to figure out. We have to reinvent and rethink innovatively how that can also become sources of economic productivity, right? So whether through fertilizer or other forms of produce, and some of the innovations up front will prevent less concentration there. So improving, addressing fertility, where 30 to 40% animals are infertile, and if you address some of it, they don't end up there. And second, if you actually do a better job of sex-sorted semen, you actually reduce the number of male animals that do not end up being productive as a dairy animal, ending up in Goshala. So there are multiple aspects you take to control how you manage that. But from a disease perspective, it is a nice thing about infectious disease. I used to work in malnutrition, neurodevelopment, very complicated areas. I like infectious diseases. I was telling one of the leading pediatrician infectious disease expert, because actually the fundamental principles don't change. Whether it is a human being, whether it is a domestic animal, whether it is a wild animal. How you address it, how you detect it, how you control it, that changes. But some of the fundamental principles don't change. So in animals, whether you're looking at slaughterhouses or whether you're looking at goshalas, some of these same principles of predict, detect, control and manage cycle is very analogous.
That's a very interesting take. Thank you, Dr. Sindhura. Dr. Singh, would you like to add something more?
I think Dr. Sindhura and Dr. Gulati as well rightly pointed out, any disease and particularly infectious diseases, we have to be three guidelines. We have to be prevent, direct and management. What you are talking about as far as this culling is this is under the management. And management has also 3 steps. Like first is depending upon what type of management, what type of disease, what type of required. The first and most important is quarantine. So if you have any sort of disease, we have to go for the quarantine. And depending upon the severity of the diseases, we have to take a decision. Whether it is go for treatment or it has to be stage of actually the infection, we have to go for the treatment. We have international guideline, we have our national guideline for making the management of the disease animal. But my perspective as for One Health, in terms of the culling and infection, and we have to learn actually this global health is going to be bigger as far as our industry, dairy industry or any industry is concerned, whether it's green revolution is concerned, white revolution concerned, yellow revolution is concerned, because one term we have to be not forget and we have to understand one very important thing. One Health is going to be a big challenge in the coming sustainability of any commodity, agriculture commodity in India is concerned. Why I am talking about? Because we are already actually suffering of because of One Health, that we are not able to export because of certain case of the eradication of some diseases. Like our country is not actually eradicated by FMD. We are not able to allow some certain part of the country as far as any as far product is concerned, milk product is concerned. Similarly, let me not only go beyond actually within the out across the country, but within the country we should not forget one thing. One Health is not the only related to infectious diseases. One Health is related with the several other part of our example. You take the example of our Green Revolution. If you go with the Green Revolution, today you cannot, means all of might be knowing, in Punjab, the indiscrimination use of pesticide is a major problem of Green Revolution. And you can believe that Punjab is a biggest actually the production of the wheat and the wheat is concerned. But the Punjab people are the wheat is the purchasing from, getting from MP to for their own eating. Because that pesticide, they know how much actually pesticide into their land, they are not going to be used. Similarly, the same thing is also it is into the white revolution is concerned. There is a lot of indiscrimination which is going into the pesticides and other chemical into the milk situation. So that's also very alarming, because once you have to be eradicate actually as far as diseases, then you have to be pile up actually several other issues to make them One Health, and then it is going to be a challenge. I think that's actually the very, very important here, the policy maker as well as industry, that we have to look at this stage itself, so that we are very competitive at this moment maybe, because our population is very high. We still not able to, because as far as our Prime Minister call is there, Amrit Kal, that presently we have actually per capita, per person use is the 460 ml. We have to go by 2047 by 1 liter per person. For that actually we are not used, because as a director of National Dairy Research, we have a responsibility making the innovation for dairy industry. We are pretty sure that we are going to achieve the target what is has been set by our Honorable Prime Minister. But the question is that how actually, because indiscrimination use of pesticide, indiscrimination use of hormone, indiscrimination use of actually the several this injection, this medicine and antibiotics, it is really going to be a great challenge. That's all actually the cumulative thing make the One Health. It is not the only infection in there. So I think this is a very rightly perceived actually the idea, and we have to be work together. Not only industry has to be supportive to be good, because they ultimately what we are going to be work today. Academia is going to be work today. It is going to be work for the industry. Otherwise, I am afraid actually. This may be not good, but I am afraid when we are going to be increase the milk production, because we are already ahead as far as our production is concerned. Milk production we are increasing 6.2%. But this milk production 6.2% is not going to be served for purpose for the any, because ultimately farmer has to be also doing. This One Health is also reaching the farmers, not only One Health of the consumer. The farmer is also consumer, but farmer is also producer. So we have to look as far as sustainability is concerned. So these are all actually very complex process One Health is concerned. I am very happy actually I can see this is a really very good topic. That is a need to be focused. We have all actually as far as industry, marketing and processing, we are very competent. In one of our previous actually the session, they said we are ahead actually as far as international is concerned, but we are not ahead as far as clean milk production is concerned. And this clean milk production, in terms of One Health is concerned, whether infection is there, whether indiscrimination, sustainability is the price competitivity. And price competitiveness is coming with this some sort of knowledge. And that's knowledge if you are going to be, because the European Union is afraid and they know we are not going, I'm not saying exactly directly in other way, but they know in India the population Like our tradition is that one person, one farmer and two farmer, they keep one or two animal. It is very difficult to make the eradication of this such type of diseases or some type of, or you can say, tagging or the identifying the animal. That's why they have a certain case of putting into the different. So these are the major issues we have to be look ahead and even 1 decade or 2 decades before to make our competitiveness as far as the sustainability in any field of not only this white revolution but also other field of the revolution. Thank you very much.
Thank you, Dr. Singh. Dr. Rangaiah, my next question is for you. Being an industry player, can you tell us what kind of innovations are you seeing in this sector, especially in the industry that you operate in, and what are some of the initiatives that you have been trying to do to promote innovation in this sector?
So definitely, Rashmi. So before that, I just want to intervene in the earlier point.
Sure.
Like, you have raised a very big social challenge. In fact, the orphan animals or whatever, stray animals or whatever, and it has been becoming a big nuisance currently. And there are some people running as hostels, goshalas, and in the midway they are throwing them out, and then they are becoming a big challenges, wherein, as you said, they are becoming center of disease challenge or whatever it is. And we are seeing, and then there are many economic like offenses are happening in those areas. So this has to be taken up. First, people have to be responsible, like whoever are throwing them in the streets because it became unproductive or sick or whatever it is. So they are throwing them. So they should be responsible and they should not do that kind of things. If people are coming forward to take up a hostel or a shelter, a house or a goshala and all that, they can as well do that, but that can be done under the auspices of definitely a local government or the main government. Unless until I think people won't know what is happening there, and then only you can consolidate and then address the issues that that particular hostel or shelter is facing. And the second thing is, of course, then the government initiatives, veterinary health or medical health or whatever is necessary, that can come into place. I think that is the most essential part. Yeah, coming to the innovations on in the industries, food industry, particularly in the dairy industry, pertaining to, connecting to One Health, this thing and all that. It starts from the backward linkages to the, it goes on to the processing, and then in the forward linkages also. It's a continuous process, and then at every point of time, the networking should be alert, like right from the animal health, where we collect milk and all that, the farmer point of view, and then collection point of view, handling point of view, transportation point of view, and then reception point of view, processing point of view, and then conversion into products, and then going to consumer, and then consumerism also. And then we should also make consumers aware that, so you should eat this product like this only. So that kind of thing. You should not eat more. There is a dose of, even the food is also should be taken in doses, not like if it is tasty, you can't take it as much as you can. So everywhere, and as I told you, at each point there is a significant biology, wherein the correct people, let them be technicians, let them be experts, let that be industry, they should take utmost care and precaution to address all those things. Unless until it is not done, everywhere it becomes problem. Milk spoils, go to bad milk goes to the plant, and then bad products will happen, and then consumer ultimately suffer. So these are various areas and where systems have to be in place in the industry also. Of course, as far as we are concerned, we are taking care of all those things. Thank you very much.
Thank you. since I've been told that we are running short of time, I want to ask one last question to all our panelists that what is your wish list or some of the action points or initiatives that you think the government should take so that this approach is followed to the T and we are prepared for any future outbreaks and pandemics. So I'll start with you, Dr. Gulati.
Yeah, as every area of sector is going for digitalization, artificial intelligence, machine learning, this has to come into diseases sector also. And one area that needs to be worked out, that every animal has to be identified. Maybe Government of India already has launched, they call as Pashu Aadhaar, that has to be implemented. They have started implementing it on cattle, bovines. They have put ear tags, and that ear tag is linked with their database of the animals, where we are getting their age, sex, breed, date of birth, date of vaccination, date of treatment, the drugs given, the vaccination given, when was AI done, when was breeding done, when was cowing happening. This every data, when it is available, we are in a better position to manage not only the productivity of the animal, but also the diseases in those animals. Because as we were talking, diseases in animals are not only of the concern of the animal. You are producing milk. Our milk production, as Dr. Saab said, 6.2% increase every year. But at the same time, the pathogens in the milk, TB, bovine tuberculosis, is one of the biggest concerns. India has launched the world is targeting zero tuberculosis by 2030. And milk is one source which is responsible for the spread of tuberculosis. So unless we have the innovations wherein we have the health status linked with the source of the milk, when we have all the data recording, it is linked with the ear tag, we can trace back milk where from this milk in this can or milk in my pouch, what I get from Amul or Mother Dairy or wherever source. If I can trace the source of that animal, source of that milk, from which animal it is coming, it is much easier to track and manage the disease. So that is why I say one innovation, I would say that the application of AI and machine learning and identifying the animals and linking the data of the animals in that will be a very, very significant, so that our product acceptability internationally will increase. We want to export the milk, as we were talking in previous session also. So if we have traceability, our acceptability will increase. So I say AI, machine learning for identifying and data storing of the animal will be a useful innovation.
Thank you, Dr. Gulati. Dr. Singh, very quickly, one or two things that you think the government should initiate or take up.
Yeah, my view is very straightforward about this, the whole One Health issue is concerned. The academy, that they have responsibility to innovate. Industry has the profitable, they have to be supportive, and the government has the policy in building, they have to implement. And what they have to do, what the academia, we have to be innovative in support of the industry, they should support it, government has to implement, that's prevention. So we have to be sure and ensure that what type of emerging disease this is going to be happen, what we have to be risk, and we have to make the prevention first. If the prevention has major policy as far as government is concerned, but if there is not prevented, we have to go for detection. That's our job, to be make the methodologies and procedure, which we have to be detectives there. And then if it is even we cannot escape, actually we have to be guideline as far as management is concerned. So the government, academia and industry join to hand together, and we have to be make certain, actually if it is innovative, we have to be develop standard, we have to be implement, we have to be guideline rules, and we have to be supportive, we have to be need fund. So we have to be make some sort of purpose fund for the different type of regulation, and we can tackle all this issue. So they're very forward, that's nothing is wrong. Thank you.
Thank you. As part of government, I guess I don't get to say I wish government did that. So I'll say what government is doing.
Right.
Right now, there is with the approval from Prime Minister's Science and Technology Innovation Advisory Council, there is a national One Health mission being developed, coordinated by our office of the Principal Scientific Advisor, and to actually have a better pandemic preparedness of both human pandemics as well as animal pandemics, and have integrated disease control across surveillance, R&D, etc. The full comprehensive approach. And for this, the key stakeholders across science and science funding agencies, CSIR, DBT, DST, DRDO, ICAR, all of those critical stakeholders are part of it. Ministry of Health, NCDC, they are part of it. Animal Husbandry, DHT is part of it. And Ministry of Environment and Forests are part of it. And also we want to take how we prepare for flood or hurricane. We have done a much better job of that, and NDMA, National Disaster Management Authority, has done an amazing job at that, and they are also part of it, so that we look at infections also as a disaster and how we put in resilience and management practices in place. So that is still in the development and is in the current process of approval at the highest level. Thank you.
Ma'am, I think there are three things that government should take some initiatives. Like they don't cost much. Of course, they are there already. One is, as I mentioned to you, for the stressed animals, shelters, orphaned animals and all that. I think some guidelines have to be set up to take care of them and ways to help them, because they are the centers of nonsense. The second thing is, like, whichever is available today, the statutory, the Department of Veterinary and Animal Husbandry, Medical, all that, they have been doing the preventive exercises. But there should be some national policy on this, which diseases are prevalent in which seasons and all that. Accordingly, they have to plan. And the third point is center of excellences. Like, there should be an integration of INDRI, NIM, IARI. So all these partners of this One Health should be integrated, and there should be, of course, sir told there is a mission, like much more higher capacity, wherein they can identify, consolidate, compile, and then what sort of things to be taken up, how to be addressed, and all that. I think these three things are most important. Thank you.
Thank you. Since we've already run out of time, I think we'll have to end our conversation. 45 minutes is too less a time to talk about with four eminent experts on this very important topic, but I thoroughly enjoyed talking to all of you, and I hope that the audience had today some great takeaways as well. Thank you again so much for joining this panel discussion.